AI has been part of healthcare for years. What's changed more recently is how US healthcare providers are organizing their revenue models around it. According to Black Book research, US hospitals are steadily moving away from offshore, labor heavy RCM models. What's unit economics means in this context is that hospitals no longer evaluate revenue operations by asking how many people are working on claims. They now measure the total cost of running the revenue engine, including cost to collect, rework caused by denials, audit and compliance exposure, operational and continuity risk. When viewed this way, AI first platforms outperform labor centric outsourcing models. The economy now favors software led architecture over people led execution. Now, let's try to understand why a labor driven operating system failed to fix problems for the industry. A study by the American Hospital Association highlighted the real issue. $6.4 billion claims, which were in claims, were delayed over 6 months. About 95% of hospitals spent more time on prior authorization. 70% of denied claims were eventually paid, but only after multiple costly reviews. The takeaway was very clear. Denials were not a payment problem, they were process problem. Adding more people onshore or offshore increased cost but did not fix the root cause. Hence, the message from the industry was very clear. Hospitals will no longer pay offshore labor arbitrage to run core revenue logic. Because of these changes, hospitals are moving away from traditional FTE based RCM contracts, wherein they were paying for people. The pricing was tied to the number of coders or analysts, and the cost increased as volume increased. Instead, they are choosing platform-based and outcome-based pricing model wherein they will pay for results, not for headcount. Software handles routine work at scale. Vendors are measured on denial reduction, first pass claim accuracy, turnaround time, and audit readiness. And the risk shifts away from hospitals toward the systems and accountable partners. In simple words, hospitals are no longer buying manpower. They are buying revenue performance and risk control capability. There have been attempts from the industry to reposition themselves, and what you must know is 70% plus firms are using AI-NLP in operations. Turnaround time has reduced by 60 to 75% in some processes. This is as per IJFMR report. The medical coding workforce is being split into two groups. Group 1, where the opportunities are shrinking. Here, employees are working towards transactional coding, rule-based work, volume-driven delivery, FTE pricing. Group 2, where fewer rewarding opportunities exist and is expected to continue to grow in value. Here, aspirants are well versed with AI supervised coding, audit defense, denial strategy, revenue intelligence, payer behavior analysis. If anything AI will do to medical coding jobs is that it will eliminate lower context job roles sooner than you realize. And that is why we at CliniLaunch Research Institute have launched AI-augmented medical coding and revenue intelligence program recently. It is for both working professionals and students who aspire to build a career in the medical coding industry. We encourage you to go through our program structure and talk to one of our student counselors on how these new programs help you to prepare for careers that are aligned with AI.
Visit us today www.clinilaunchresearch.in